Hi, good afternoon, everyone. We will start at exactly 2 p.m. Thank you. Hi, good afternoon everyone sa mga nanonood po sa aming Facebook page live and via Zoom. Thank you po sa panonood sa aming live webinar on how to migrate as a healthcare assistant in Canada. Of course, before I start, let me introduce myself first. My name is Reynel Del Rio and I'll be your host for today's webinar po. And of course, with our partners call Miss Jenica Licerio. Si Miss Jenica po ang magdi-discuss about our partner school, Stenberg College, and our program, Healthcare Assistant po. Of course, what makes us different from other immigration services? So of course, we have our own immigration consultant. His name is Mr. Israel Roman. His license number is R524540. And of course, as I mentioned, he's a licensed Canadian immigration consultant, and he's also an active registered nurse in Canada po. And of course, our main office is located at Canada in 6057 Dumont Road in Nanaimo, British Columbia. Yes po, yung main office po namin is nasa Canada na po mismo. And our office here in the Philippines is located at President JP Laurel Highway here in Lipa City, Batangas po. Of course, you can all as I mentioned, we have our own immigration consultant. He's a licensed Canadian immigration consultant registered with the College of Immigration and Citizenship Consultant po. And of course, our company is Roman and Associates Immigration Services Limited. We're a registered Canadian immigration firm in BC, Canada po. Of course, to know if you're talking to a legitimate company, you can always visit Canada Business Registry so you can look for our permits and certificates po. And of course, our own immigration consultant, Mr. Israel Roman, you can always search him in any search engine like Google. Simply type Israel Roman po. And of course, our topic today is how to work as a healthcare assistant in Canada. First, you need to apply for a registration with the Health Worker Registry. And of course, in Basic Care Aid and Community Health Worker Registry po. But for international educated healthcare professional po, or graduate of healthcare assistant program outside the Canada, the requirement for you is you must be residing in Canada po. So well, in short, hindi po tayo makakapag-apply ng healthcare assistant if wala po tayo sa Canada. So ano po yung pwede nating gawin or ano po yung way para makapag-work tayo as a healthcare assistant in Canada? Of course, with the help of our partner school, as I mentioned a while ago, Stenberg College, and the help of our team, Roman and Associates Immigration Services po, this will be your gateway in studying and working as a healthcare assistant in Canada po. Of course, as I mentioned, later we will have Miss Jenica Licerio, so she can discuss about the school and the program po sa Stenberg College po. And of course, the best option to come to Canada as a healthcare aid is, of course, you need to apply for a study permit po. And after applying for a study permit, of course, in our partner school, Stenberg College, you will take the course Healthcare Assistant course or program. Of course, in our partner school, Stenberg College po. And after studying the healthcare assistant course or program, what's next? So after that, after you finish your study and you already finish your program, healthcare assistant in Stenberg College, next thing you do is you can now apply for a work permit po. Yes po. After studying as a healthcare assistant po, you can now apply for a work permit with LAMIA po. And then after that, after working You can apply for a permanent residency under the caregiver pathway or program po. But if you want to continue your study, let's say you're a registered nurse and you want to continue your study, our partner school, Stenberg College, also offers this kind of courses po, like the postgraduate diploma in Canadian nursing, and other course is early childhood education. And of course, the question we always encounter is, yes, sir. After I finish my study in Stenberg College and I take the healthcare assistant course po or program, is there really a job waiting for me in Canada? So, syempre, yan po yung mga question na lagi naming na-encounter po sa mga kliyente namin. And of course, here on the next slide po, makikita po natin kung gaano ba kadami ang available jobs na nag-aantay sa atin as a healthcare assistant po in Canada. Of course, as you can see on your slide, depending on your location po, these are the available jobs as a healthcare assistant in Canada. Flash on your screen, as you can see, depending on location, in British Columbia, the available jobs waiting for you is 117, in Lower Mainland, 53, so on and so forth. So, sa slide pong to, makikita po natin kung gaano nga po ba kadami ang nag-aantay na work sa atin as a healthcare assistant in Canada po. And of course, after knowing na may work talaga after knowing na may nag-aantay talagang work sa atin in Canada as a healthcare assistant, the second question we encounter is how much po yung salary po ng isang healthcare assistant in Canada. And of course, flash on your screen po, these are the sample wages po depending on the community or area po kung saan tayo nag-work as a healthcare assistant po. For example, in British Columbia, we have 3 categories of wages po. We have the low, median, and high po. Kung makikita niyo po sa low, median, and high po, that's the capacity of your employer to pay towards their employees po. For example, if you're working as a healthcare assistant in British Columbia, in low, you're earning as much as 18 Canadian dollar per hour. In median, 22, and in high, you're earning as much as 25 per hour po. In Cariboo region, same as in British Columbia, you're earning as much as 18 CAD per hour, I mean. In median, 21.85. And in high, you're earning as much as 24.86. So on and so forth po. So depende siya sa area kung saan po tayo nagwo-work po. And of course, after knowing kung magkano nga po ba yung salary ng isang healthcare assistant nga po, the question again na na-encounter po namin, sir, what if natapos na po yung first contract ko po as a healthcare assistant? Meron pa po bang work or job na nag-aantay sa akin po? So, flash on your screen po. These are the job opportunities over the next 3 years po in Canada. So, it depends again on the location po. Kung makikita niyo po sa screen niyo po, in Alberta, the job prospect po is good. So, makikita niyo lang po sa slide na to, how good opportunities in Canada. So, hindi po tayo mawawalan ng opportunity if we work in Canada po. And of course, after knowing po kung is there really a job waiting for you, kung magkano po yung sasahodin natin as a healthcare assistant, is there really a job after matapos ko yung first contract ko, how much naman po yung hourly rate as a healthcare assistant? So, bibigyan ko po kayo ng sample computation kung magkano nga po pa ang kinikita ng healthcare assistant in Canada po. And of course, the sample wage computation for a healthcare assistant in Canada po, of course, if you're working 40 hours a week and you're earning as much as 25.83 per hour, so you're earning as much as 1,033 Canadian dollar po per week. Per month, you're earning as much as 4,132.80 Canadian dollar. And in a year, you're earning as much as 53,726 Canadian dollar po. So, let's convert it to Philippine peso po. So, meron po tayong basihan kung magkano nga po ba siya sa Philippine peso po. So, if yung Canadian dollar po is averaging to 43 pesos per CAD, you're earning as much as 2.3 million po as a healthcare assistant po. So, my question for you is, if you're a registered nurse here in the Philippines and you're, let's say, nag-aalaga po tayo ng 10 to 20 patients a day, do you think makaka-earn po tayo ng 2.3 million in a year? So definitely the answer is not po. So ganyan po kaganda or ganun po kalaki yung ma-earn po natin as a healthcare assistant in Canada po. And of course, the other job na pwede po nating applyan as a healthcare assistant po is an in-home caregiver. So ano nga po ba si in-home caregiver? So this is more on nag-aalaga po tayo ng elderly patient po dito sa Canada. So of course, magkano nga po ba ang sinusweldo ng in-home caregiver in Canada po? Of course, as you can see, depending on the area and community pa rin po, yan po, flash on your screen, makikita nyo po kung magkano po yung wages ng isang in-home caregiver in Canada. So in Canada particular, in low, you're earning as much as 12.91. In median, you're earning as much as 16.85. And in high, you're earning as much as 24 CAD per hour po. So let me give you a sample computation po on that one. So of course, if you're working as an in-home caregiver po in Canada, if you're working 40 hours a week and you're earning as much as 16.85 per hour, your earning is 674 in a week. And in a month, you're earning as much as 2,696. And in a year, you're earning as much as 35,048 Canadian dollar po. And of course, let me give you a computation po kung magkano siya converted to Philippine peso po. So in the Philippine peso po, in a year, as an in-home caregiver in Canada, you're earning as much as 1.5 million pesos po in a year po. And of course, the question again is, if nurse nga po tayo here in the Philippines, taking care of 10 to 20 patients a day po, definitely nakakapagod po yun. And compared to the salary po in Canada and the Philippines, definitely mas malaki po talaga ang kinikita if our work is in Canada po. And of course, ano nga po ba ang advantages in joining with us po? Of course, as I mentioned, we are partner with the college that delivers exceptional education. So later nga po, that's the Stenberg College, that later nga po si Miss Jenica po yung mag-explain sa atin on ano nga po ba yung Stenberg College and ano nga po ba yung courses na ino-offer niya. And of course, we have a reasonable administrative fee. 50% of on our professional or consultants fee. And of course, lahat naman tayo, kapag nag-work tayo sa Canada, we want our job security. So you will have your job security po in Canada. And of course, you will have your employer with LAMIA. So LAMIA nga po stands for Labor Market Impact Assessment po. And you have a multiple option to stay in Canada after you study po. So, you don't have to go back to the Philippines po after nyo mag-aral sa Canada. Of course, as I mentioned a while ago, sobrang daming opportunity na nag-aantay sa atin after we finish our program or course in Canada po. Of course, as I mentioned, with the help of our partner school, Stenberg College po, and our team here in Roman and Associates Immigration Services po, this will be your gateway in studying and working as a healthcare assistant in Canada. So with that, I will now transfer the hosting to Miss Jenica. So ma-discuss niyo na po ang how about Stenberg College and the program they offer po. Okay po, so here is it.
Hi, Rainier.
Hello, ma'am. Jenica, I'll transfer the hosting.
Yeah.
Okay, there you
Okay,
go.
ma'am. Thank you, ma'am.
Thank you. Hello, good afternoon, everyone. Thank you for joining today's webinar. My name is Jenica, and I will be discussing the Healthcare Assistant Diploma Program with you. So let me share my screen. Reniel, paki-advise na lang if hindi nakikita ha. Is it all
Okay.
good?
Yes,
All
ma'am.
right.
Kita naman po.
Okay. Okay. So first, I'm gonna show you the introductory video of Stenberg College. Okay, there you go. So I'm going to introduce Stenberg College to you. Let me give you a bit of an overview. Excuse me. All right, so Stenberg College is a private post-secondary college. We were founded back in 1990 by Mary Jane Stenberg, and we started off as a nursing school. Okay, so because of the success of Stenberg College with the graduates, we were acquired by the education company called Tech Global after 10 years in operation. And we have become a well-established medical school in Surrey. We deliver healthcare programs, and then we eventually ventured into other industries. So may mga programs kami under education, human services, and business. But for today, we're just going to talk about healthcare assistant. So as mentioned, our location is in Surrey. So if you're not aware yet, Surrey is a suburb of Vancouver. And we're just about 40-minute train ride away from Vancouver downtown. So the campus is located in the central city. So one of the things that sets us apart from the other colleges is that we have a very strong employer and industry relations. So this is something that I'll be discussing in the next slides. So once you become part of Stenberg College, we provide you the support, the services to reach your goals. So whatever goal you have, let's just say that you want to study and then go back to your home country, or for those of you who wish to pursue permanent residency in the future, we have all the services that will allow you to do that. With the support and services listed on your screens, I just want to highlight two: the academic support and the career services. As an international student, I think na-mention naman na ni Rainiel, you're allowed to work 20 hours per week while you're studying. And during holidays and breaks, you're allowed to work full-time. Now, these two would be yung pinaka major na pinagkakaabalahan ninyo eh. Study and then work. So with the studying, I just want to highlight na mag-aaral po tayo, okay? So hindi po natin siya pwedeng pabayaan. And with that, we want to make sure na nakakapasa din kayo sa mga courses ninyo. So we have the academic support. If you want to, have extra time to discuss topics or yung mga napag-aralan ninyo na lessons, you need more discussion with that, you can schedule a one-on-one session with your instructor. And we also have our student success coordinator. Also, we have free English classes that you can attend to. So, pwede kayong mag-sign up doon. One of the things na hindi masyadong uso sa Pilipinas is a life coach. But according to my Filipino students, it has been helpful sa kanila during the first couple of months na nag-start sila ng program. Simply because sa umpisa talaga, you have to adjust to your new environment, and then you have your work, you have your school. So somebody to guide you and somebody to help you adjust to your new lifestyle and environment. Nakatulong ng malaki sa kanila. Okay? So if that's something na gusto nyong subukan, you can just let us know. And all of the services naman, they're for free. Another thing that you should expect when you start your school with us is that we have a small class size. Okay, unlike what you see on TV na over 100 yung class, nasa auditorium, it's just gonna be a boutique type of, classroom, maliliit lang. And we have maybe a minimum of 10 to maximum of 20 students per class. And we maintain it na ganun lang, because we believe it's a more conducive environment for learning when you're able to really discuss topics and ask your questions. Now, another thing that I wanted to highlight here, sabi ko nga, is the career services. So you will meet them during the orientation. Career services role is to help you, number one, with your resume so that it can be a Canadian standard type of resume. If you need assistance with interviews, if you want to do simulation with them, you can do that. And then they connect you to our partner employers. So if you need help with looking for a part-time work or long-term work sponsorship, career services will be helping you. In connection to the work, to the employment, all the programs that we provide or we deliver for international students, they will have co-op in them. So co-op means cooperative work experience. Here in the Philippines, it's more commonly known as internship or OJT. So during the co-op, you are going to work for 20 hours per week with our partner employer. So you don't have to look for an employer anymore. We already have the employers. So we do the job placement for you. So 20 hours per week sa co-op. And then you can add the 20 hours coming from your student permit. Therefore, during the co-op period, you can maximize your earning potential because you'll be working up to 40 hours per week. Okay, so now let's move on to the program. So we have a healthcare assistant diploma. We have a video here I want to show you before we dive into the details of the program.
I have nothing but respect for the healthcare assistants, because if it weren't for the healthcare assistants, the nurses don't know the patients or the residents the way that the healthcare assistants do. They are the first line of defense, if you will. They come to you and they know when your patient is having any kind of a bad day or a good day. They know them way better than I do as a nurse. And so I 100% depend on the healthcare assistants to come to me with whatever needs to be done for that patient. What I first noted about Stenberg College right away when I started here was that there are so many resources available to the students, and the faculty and the school itself really cares about the success of Stenberg College students. What particularly impresses me about the HCA program here is the in-depth and breadth of knowledge and curriculum that is taught. It's not only just the provincial curriculum that's being taught, but it goes further so that the healthcare assistants can understand the diagnosis, not just what to do when this person has this. If they fully understand it, then they're going to do better in their career.
Our HCA program, I feel, is one of the best because of the simulations lab, the nursing lab, the way that they have integrated the nursing instructors to be able to have them in the same classroom, sometimes in the same lab as nursing students. So they have that cross-pollination of information with each other.
I get really excited when I teach, and I'm sure some of my students, if asked, would say this about me. I'm not just talking about diabetes, for example. I get involved in the background of it and then how to care for said person with diabetes. And so what I hope to pass on to my students is to get excited about it and not just treat it as just a job. It's not just a job that pays the bills. You're helping people, you understand, you do this, and this is the rationale for it. And to be able to help people, and not only the patients, but their family and their extended family and the colleagues that you work with, I think it's really exciting for me, both on the floor, nursing, and to instill that into my students. What I like my students to take away from the classroom, not only into their clinical, but into their careers, is the ability to believe in themselves and that they really are making a difference.
Growing old is inevitable, I suppose, and from my point of view, I just do the best I can for myself and for other people. I really think that here the staff are wonderful, and I'm just thankful that I'm in a place like this.
Before the HCA program, I was a housewife and I have regular jobs, but not a career.
Coming to Canada, I have like big dreams. For a starting point, it is very hard. I got like little bit confident. Okay, I can work in a gas station, and I started working there. But going and coming back, it's the same routine, and then it's just stuck. The life is stuck.
My life before this, I was a digital designer. It was just hard to deal with contract jobs and not knowing whether if I'm able to support my son next week.
When I first started, all over it was a good experience, but I did have some obstacles. With the extra help from Stenberg staff, I pulled through with success.
We work together. If there is any kind of problem, personal problem, or about the education, so we work together, and so that everybody is fine.
We were given all the tools and all the skills that we needed to have in the real world.
Now, I got more confidence that I can do better.
All the comments I got from my preceptor, they said it did not feel like they're working with a student. It felt like they're working with another HCA.
IRIS called me one day to come for an interview. So, and then I got the job.
I have a stable job where I have income coming in, which I love doing. And then with that, I can also invest into my hobbies, which is design now.
I love working with elderly people. I love making a change, giving my minute or two and talk to them, make a difference in their life.
Having this job is perfect for me.
I remember one time I did go back, even though I was already off clock, I went back and went to see one of the residents. And just seeing their faces react to you, even coming back to them to talk to them, it's just rewarding. Not only it feels right, but it just, you're happy, knowing that you're making other people happy. I have a feeling that eventually people are going to realize this is a good, perfect career choice.
I have no
Okay, there you go. I hope you learned something from that video, and it has given you an insight on how healthcare assistants operate in Canada. So if you want to become one, just to let you know also, there are different terminologies for HCAs. They can be called personal support workers, healthcare assistants, healthcare aides. All right. So as a healthcare assistant, the high demand of employment here would be normally coming from home support agencies and residential care facilities. But as an HCA, you can also work in a hospital setting, working alongside nurses, or you can even take care of children. Now, our program is fully recognized by the BC Care Aid Registry. So there is a regulatory body for healthcare aids. Okay, this is to maintain the standard of practice of the healthcare aids. So that's BC Care Aid Registry. You can Google that. And what you'll see is that Stenberg College's diploma program is fully recognized. Now we have to comply to the requirements of BC Care Aid Registry, okay? And that includes English proficiency. So I'll be discussing that in the next slide. As an HCA, you are an essential worker in Canada. So there is a high employment demand. We have a paid co-op for you and a job placement. We will assist you in getting your registration with BC Care Aid Registry after you complete the program. And the best thing here is that we have 100% employment rate. So now let's talk about the details of the program. There's two variations and it will depend on your IELTS result. Okay, so you might ask, bakit may IELTS? Yes, hindi po natin siya pwedeng ma-waive because it's a requirement by the BC Care Aid Registry. Hindi kayo ma-register not unless meron kayo nito. But the good thing is general or GT or academic would be allowed. Okay, so it's not limited to just academic. So for the HCA, if your score, ang nire-require talaga ng BC Care Aid Registry is 6.0 overall score. Speaking and listening 6.0, and then reading and writing 5.5, as you can see on your screens. So that is the requirement. Now, if you meet that result or even higher, you can take the first variation. So you'll be studying for 8.5 months. And within that, you will already have 2.5 months of paid co-op. The total tuition fee for that the tuition fee already includes the assessment fee, registration, insurance for the first 3 months, your materials, books, okay, kasama na lahat. It's 15,400 for the full duration. You don't have to pay the whole thing. Pwedeng initial deposit of 5,150 CAD, and then the rest of your balance, you can pay that per installment when you're already in Canada. Now, let's just say na medyo nagkulang yung IELTS score natin ng 0.5, okay? Halimbawa lang, will we still accept? Okay? Yes, we will still accept you. So IELTS, a 5.5 overall score is going to be acceptable. Speaking and listening 5.5, reading and writing 5.0. However, second variation na yung magiging enrollment ninyo. This means you will have a 3-month English studies component. And that 3-month English studies component, you can still work part-time and it will have a preparation for the core program. So the total duration will now become 1.3 years. Okay, and longer yung co-op natin dito, it's 6 months paid co-op. Now, for those of you na mataas naman yung IELTS ninyo, but gusto nyo mag 3-month English studies, okay rin lang. Pwede yun, if that is the variation that you're going to choose. So the total tuition fee for this is 18,950 CAD. Again, initial deposit is 5,150, and the rest of your balance is paid per installment. Meron bang discounts and bursaries? Yes, we do. So I highly encourage you to submit your resumes to Roman & Associates so that you can get a free assessment whether you qualify for the program or not. Because if you qualify, we encourage you to enroll this year. Okay, because the discount and the bursaries, they're only applicable to those who will be enrolling this year. And when I say enrolling, that means that you're going to reserve your slot by paying your initial deposit of 5,150 CAD. Now, if you enroll this year, kahit ano pa yung intake ninyo for 2023, we will reimburse you of your IELTS cost up to 350 Canadian dollars. So, automatic siya madededuct sa tuition fee ninyo. We will also be waiving your assessment and registration fee worth $400. So that's a $750 savings for you. So now let's talk about the employment opportunities. Actually, this is Sir Israel. Sir Israel is, he's the owner of Roman & Associates, and he's been helping our students. As you can see, they're in the Nanaimo region, and all of our students now have sponsorship after they complete their program with with us, with the help of Sir Israel. So marami tayong partner employers. Actually, it's not just Nanaimo Hospital, but we have Fraser Health, we have Island Health, and other different private employers. There's a bit of a background noise. I apologize. I'm working from home. All right, so let's move on with immigration pathways. So our program has an immigration pathway. So you just need to accept the work offer actually, and you will be qualified to these immigration pathways. So as mentioned kanina, 100% employment rate on HCA. So just to finalize the presentation, to summarize everything that we've discussed, so Stenberg, we have over 30 years of experience in delivering quality education. We have outstanding support services to our students and graduates. Overall at Stenberg, with all the other programs, we have 98% employment rate, but 100% on HCAs and nurses. So we have paid co-op, job placement, even conditional job offers are available. This means na may job offer na kayo, and you're just, the only condition is to complete the program and get registered. We have immigration pathways for you, and the tuition fees, they're affordable, and we have a flexible payment. So that is it. That's for my part. I hope that you learned something from us today. So back to you now, Rainiel. Thank you very much.
Thank you, Ma'am Jenica. And of course, we have a question here, ma'am. So let me answer this. Can I bring my family along? Hi, Ma'am Chipo. Yes, you can always bring your family, but there's a risk because you will need to prove to the visa officer that you're going back to your home country after you finish your program. And of course, it's much expensive if you bring your family. But yes, you can always bring your family po.
Can I just add something to that, Rainiel? Because
Sure,
this
ma'am.
is a bit of a controversy when it comes to students na nandun na. So, because we are a private institution, you can bring your dependents along, right? You can bring your children with you. However, if you're planning to bring your spouse, it will not be an open work permit because there was an update back in 2019 or 2020? I think it was 2020. Nag-update si IRCC na for private institutions, the open work permit will not be available. So your spouse, they can do visitor visa. However, kasi ang HCA, always consider this, if you're bringing dependents along or spouses, it will always be a risk to your student application. So as an option for those who need to bring their spouses along, we can accommodate them as a student visa also. If both of you are doing that, we will even give you more discount. So this is a per case basis. Again, if your spouse couple application, we will give you further discount. Aside pa dun sa bursary na pinakita ko sa inyo, it can be up to 50% discount on tuition fee. So we have to assess first your profile. But for those naman na makakatiis, kasi 8.5 months lang siya, right? Napakaikli. We highly recommend to wait it out, and then kapag tapos na yung program, you can bring your spouses along kasi mag-a-apply na kayo na yung iba for PR, maybe they will apply, right? So that is it, just to clarify that. But of course, the children, they're always welcome. Wala po tayong limitations when it comes to you bringing your children along. All right, thank you.
Okay, ma'am. Another question, ma'am. Sorry, Ma'am Abigail, I can't understand your question. Please, ma'am, what about you don't have IELTS, which means you can take part? Medyo
I
confusing.
I think ang tinatanong ni Miss Abigail dito is what if there's no IELTS? Unfortunately, we cannot accept without the IELTS. Again, this is not just the school's requirement. In order for you to practice as a registered HCA, the regulatory body requires it. Okay, if you're not Canadian, then you cannot be registered without IELTS. The other option is CELBAN. Again, another English proficiency test, but the most common, most accessible would be IELTS. General is accepted. So you have to do the IELTS exam, and it's always an advantage for you to know what level of proficiency you have, right? And you'll be able to assess whether you're ready to study in Canada because everything will be in English. So take that exam and then you apply. All right. Thank you.
Thank you, ma'am. I think we don't have question from Zoom and Facebook. So thank you, Miss Jenica.
Thank you, Rainiel.
Thank you, ma'am. And for that, I will share my screen first. So what are the next step po na kailangan natin gawin? Of course, you can send your detailed resume for an eligibility check to assessment@romancis.ca po. And don't forget our subject line, assessment for HCA at Stenberg College po. And of course, if you have a question or clarification po, you can always email us here in this email po. And of course, thank you so much po sa lahat na nag-attend ng aming live webinar po. Thank you so much po.